Today we're going to be talking about the muscles that comprise the posterior abdominal wall. There are 5 muscles: psoas major, psoas minor, iliacus, quadratus lumborum, and diaphragm. We're going to be talking about the diaphragm in detail today. The diaphragm creates the roof of the abdominal cavity. There are a few openings through the diaphragm. First, we have the caval hiatus, which allows the inferior vena cava and the terminal branches of the right phrenic nerve to pass through. Then we have the esophageal hiatus, which allows the esophagus, right left vagus nerve, and esophageal branches off the left gastric artery and vein to pass through. And we have the aortic hiatus right over here. That allows the aorta, thoracic duct, azygous vein to pass through. And then over here we have the sternocostal triangle, which allows the lymphatic vessels and superior epigastric vessels to pass through. Over here we have the left crus, and over here we have the right crus. The right crus can act as a sphincter surrounding the esophageal hiatus. The median arcuate ligament over here unites the right and left crus. The medial arcuate ligament covers the psoas muscle over here. And then we have the lateral arcuate ligament that covers the quadratus lumborum right over here. Most of the diaphragm is controlled by the right and left phrenic nerve for both motor and sensory. However, for sensory, the lower 6th and 7th intercostal nerves and the subcostal nerves supply the peripheral diaphragm. The arterial supply is through the superior phrenic artery, the periocardic phrenic and muscular phrenic artery, and the inferior phrenic artery. The venous drainage has a similar route to the arterial supply, and so that goes back to the internal thoracic veins, the inferior vena cava, and the hemizygous vein, which all eventually lead back to the right atrium of the heart.